All right, so Dad, what do you attribute the biggest successes in your life to? How about oh yeah, let's start off with that one. Tribute, like let's say
Well, just hard work.
hard
If,
work,
if,
right?
if, you, if you pick a profession that you really enjoy, then hard work is not punishing. It's enjoyable. And I was fortunate that I picked a field that I am passionate about, and also a specialty, pathology, which I'm passionate about. So it was easy for me to work hard at being successful in that profession because I enjoyed it and still enjoy it, as you know.
Yeah. I know we haven't. I don't think we've ever really talked about this. Um, Certainly with me, we have. But do you have any failures in your life that you have overcome or
Well, as
personal strife?
yeah, the thing that jumps quickly at me is I did not get into medical school the first year I applied, and that was very challenging because I was finishing college. I finished college, and I wasn't in graduate school, wasn't in medical school, and so I moved to Boston, where I worked in a hospital, and in retrospect, it actually turned out to be a great benefit because I had my gap year before people even talked about gap years.
Yeah.
And I was able also to work in a hospital, and that reinforced that I really wanted to be a physician. So I was going to work hard at, improving my record and reapplying.
Right. Well, I think in some ways the maybe the inability to get into medical school the first time equates to the kind of stagnation that I'm experiencing right now during the pandemic. Just
Yeah.
this period of life of kind of not knowing or uneasiness, but I think I'm heading in the right direction.
Yeah, but it's a lot more challenging for you because, you know, the the real outcome of this pandemic is not clear,
Right.
and the length of it is not clear, and that's got to be a great challenge for you as you make your next steps.
Mm-hmm. If there's one piece of advice you could give your 20-year-old self, what would it be?
My 20-year-old self,
Yes.
or you?
Your 20-year-old self.
Just stay focused. Be kind to people. There's no excuse for bad manners.
Mm-hmm.
And treat everybody the same, whether it's a professor or the person who comes and helps keep our house clean.
Mm-hmm.
Grandpa was really, really strong about that. He treated everybody the same, no matter what stratosphere, what occupation they had, or he was very, very clear about that. And I've tried to live like that.
Got it. So you recently went back to Brooklyn during the pandemic to volunteer your services in some form. I'm not sure exactly what happened.
Yeah, so
If you want to talk about that.
basically, my first exposure to the pandemic was when being a pathologist, I'm called into the hospital to look at tissue biopsies and render a diagnosis. And it was about 5 or 6 weeks ago that I went to Maimonides Medical Center in Brooklyn to interpret a bone biopsy on a tumor in a 16-year-old. And I just couldn't believe what I saw in the hospital. I mean, they were already overwhelmed with COVID cases, and there were so many people dying that they actually had refrigerated vans on the streets outside the hospital to keep all the dead bodies from decomposing. So that was my first experience, and I immediately asked if I could be of any help, not only at Maimonides, but at Downstate Medical Center, and also out here at Southampton Hospital. But there are a couple of things. First of all, there wasn't any help needed from me in particular, probably because I'm a pathologist and there was a much greater need and it is still a greater need for people who are comfortable working in intensive care units, for which I've had very little experience. So the real need was for anesthesiologists, intensivists, emergency room doctors, and that kind of person, physician. I also, Governor Cuomo, as you know, early on in the crisis, asked for help from any healthcare professionals, including retired ones. So I signed up for that, and it was a very lengthy and elaborate application. And so far, I haven't heard of any need. So as of now, I'm still on what's called the Orange Response Team for SUNY Downstate Medical Center in Brooklyn, but they haven't called. I suspect, again, because of my super specialty in just tissue biopsy interpretation, I'm not as qualified a need as is needed at this point.
Right. Well,
Although I may add that what I have been doing, which is very different than anything I've ever done in my career, and which thankfully you've helped me with, is I do, as you know, I've done a lot of teaching over the years, and I'm very active teaching in many orthopedic training programs. And because of the need to have very little contact, close contact, especially in a hospital, especially with other doctors that are in training, I've converted virtually all my lectures to virtual lectures, and that's been a real interesting change for me.
and when you say interesting, do you enjoy that change? Do you see yourself doing that more often going forward?
Well, I think the pandemic is going to dictate doing it more often, but no, I don't think it's as good as being there in a room with 15 or 20 or 30 residents, where we have the face contact, where we can watch each other, and a lot of teaching is those nonverbal feedbacks you get, just facial expressions, or when I'm in a room with a resident and I can ask them a question, and I see that they're perhaps struggling a little bit, I can be more on top of helping them out. So I think the pandemic is going to dictate doing virtual teaching for at least many months more. But no, I hope to get back into the hospitals and hands-on teaching going forward. Also, with pathologists in training, you really need to sit with them at a microscope to discuss the cases, and it's difficult to do virtually.
Well, yeah, my next question was going to be, do you think the residents and the pathologists would agree with you, who are on the other side of the virtual lecturing? I think a lot of people in your position would agree that it's much better to get hands-on experience. So I was wondering what you think the residents think about this time, and
I think their education is hurting because I'm not there. Because very often after my lecture, I linger because residents have questions, they want to talk about things, and sometimes it's a little private, so they're not going to do it on the Zoom. And I think very much, at least in my experience with the residents that I teach, I think they very much would prefer to have on-site, in-person lectures where they can see me and if necessary, talk to me privately afterwards, which is hard to do under the current circumstances. So I think the residents would actually prefer the on-site teaching. And I think with colleges now going so much online, and God knows what's going to happen in the fall, that's a big deal.
Yep.
Because online teaching certainly has its limitations. I mean, it's technologically amazing what we can do now, which we couldn't do just 10 years ago. But it's not like being in a room with a person and interacting.
Yeah, I think a lot of people would agree with you, and I think I definitely agree that I get more out of an in-person, hands-on experience setting. Same thing with any job or any
Right.
hobby. You don't get the same satisfaction playing a surfing video game as you would actually surfing.
It's absolutely true. Yeah.
So I think I don't know. We'll have to see what happens.
I mean, just think of the Supreme Court now. They're doing these virtual sessions with lawyers coming before the Supreme Court, and that takes away all the nuances of having the lawyer in person facing the judges. It's like a whole different legal framework.
Yeah. All right. Well, that's all we have time for. So thank you.
My pleasure.
Appreciate it.
Yep. Stay safe.